You know what's terrifying? Taking a natural supplement that everyone's raving about, thinking you're doing something healthy for your body, only to discover it's actually making things worse. That's exactly what's happening to thousands of people with ashwagandha right now. Listen, I get it. Your Instagram feed is flooded with wellness influencers calling ashwagandha a miracle herb. Your stressed-out friend swears it changed their life. The bottles are flying off the shelves at every health store. And yes, for many people, ashwagandha can be genuinely beneficial. But here's what nobody's talking about. For certain people, this ancient adaptogen can trigger serious health complications that could land you in the doctor's office. The problem? Most people have no idea if they're in that high-risk category until it's too late. But here's the good news. Today, I'm going to give you complete clarity on exactly who should stay far away from ashwagandha, what side effects you need to watch for, and how to know if you're putting yourself in danger. By the end of this video, you'll have the knowledge to make an informed decision about whether this supplement is your friend or your foe. Because when it comes to your health, guessing games can be deadly. Before we dive in, do me a favor, hit that like button if you value evidence-based health information, and subscribe so you never miss critical wellness content that could protect you and your loved ones. 1. Pregnant and breastfeeding women. Let's start with the most critical group. If you're pregnant or breastfeeding, ashwagandha is not just risky, it could be dangerous for both you and your baby. Here's what the research shows. Ashwagandha contains compounds that can stimulate uterine contractions. Think about what that means in practical terms. During pregnancy, especially in the first and second trimesters, these contractions could potentially lead to miscarriage or premature labor. This isn't speculation or fear-mongering. This is based on traditional medicine warnings that have been documented for centuries, combined with modern pharmacological understanding. But it gets even more concerning. There's currently insufficient safety data on how ashwagandha's active compounds transfer through breast milk and affect nursing infants. The chemical constituents in ashwagandha, particularly the withanolides, are powerful bioactive substances. We simply don't have enough research to know how these affect a developing baby's neurological system, hormonal balance, or organ development. Some women argue, but it's natural. Our ancestors used it. Here's the reality check. Traditional Ayurvedic practitioners specifically avoided giving ashwagandha to pregnant women for these exact reasons. Natural doesn't automatically mean safe for everyone in every situation. Poison ivy is natural too, but you wouldn't rub it on your skin, right? If you're dealing with pregnancy-related stress or postpartum anxiety, talk to your healthcare provider about safer, evidence-based alternatives. Your baby's health is not worth the risk of experimentation. Your baby deserves the safest start possible. Don't let trendy supplements compromise that. 2. Autoimmune disease warriors. If you have lupus, rheumatoid arthritis, multiple sclerosis, Hashimoto's thyroiditis, or any other autoimmune condition, listen very carefully. Ashwagandha could throw gasoline on your inflammatory fire. Here's what's happening in your body. Ashwagandha is classified as an immune-boosting adaptogen. Sounds great, right? Except when you have an autoimmune disease, your immune system is already overactive. It's literally attacking your own body by mistake. The last thing you need is something that ramps up immune activity even more. Research has demonstrated that ashwagandha can increase the production of certain immune cells and enhance immune system vigilance. For someone with a healthy immune system, this might help fight off infections. But for someone whose immune system is already in overdrive and confused, this could potentially trigger more aggressive autoimmune attacks, leading to increased inflammation, worse symptoms, and potential disease progression. Let me paint you a picture. Imagine your immune system is like a fire alarm that keeps going off for no reason. That's autoimmune disease. Now imagine throwing a supplement into the mix that makes that alarm even more sensitive and loud. That's potentially what ashwagandha does in autoimmune bodies. I've heard from viewers who ignored this warning, thinking it's just a herb, only to experience severe disease flares that took months to get back under control. Some had to increase their immunosuppressant medications. Others ended up in the hospital. If you have an autoimmune condition and want to manage stress, work with a functional medicine doctor who understands your specific situation. Your immune system is already fighting a war. Don't accidentally arm the wrong side. 3. Thyroid medication users. Are you taking thyroid medication like levothyroxine, Synthroid, or any other thyroid hormone replacement? Then ashwagandha could turn your carefully balanced treatment plan into an unpredictable roller coaster. Here's the science. Ashwagandha has been shown to significantly boost thyroid hormone production, particularly T4 and T3 hormones. Multiple studies have confirmed this effect. In fact, some research shows it can increase thyroid hormone levels substantially within just 8 weeks of use. Now, if you have hypothyroidism, underactive thyroid, and you're not on medication, this might actually be beneficial. But if you're already taking thyroid medication that's been carefully calibrated to your body's needs, adding ashwagandha is like having two drivers fighting over the steering wheel. What happens next? Your thyroid hormone levels could shoot up too high, leading to hyperthyroid symptoms, racing heart, anxiety, insomnia, excessive sweating, unexplained weight loss, trembling hands, and feeling constantly wired and exhausted at the same time. I've personally spoken with people who developed heart palpitations and panic attacks after combining their thyroid meds with ashwagandha supplements. Even more problematic, this interaction makes it incredibly difficult for your doctor to properly adjust your medication dosage, because they can't tell what's coming from the medication and what's coming from the supplement. Your blood work becomes unreliable for treatment decisions. And here's the kicker. If you have hyperthyroidism, overactive thyroid, ashwagandha could make your condition dramatically worse by pushing already elevated hormone levels even higher. If you're on thyroid medication, ashwagandha is a hard no without explicit approval from your endocrinologist. Don't let a supplement sabotage the treatment plan that's keeping you healthy. 4. Blood pressure and diabetes medication users. If you're managing your blood pressure or blood sugar with medication, ashwagandha could create a life-threatening situation you never saw coming. Let me explain the mechanism. Ashwagandha has been scientifically proven to lower both blood pressure and blood sugar levels. In isolation, for someone without these conditions, this might be helpful. But if you're already taking medications to control these parameters, you're essentially doubling up on the same effect, and your body can't distinguish between pharmaceutical and herbal interventions. For blood pressure medication users, combining it with ashwagandha can cause your blood pressure to drop dangerously low, a condition called hypotension. Symptoms include severe dizziness, fainting, blurred vision, fatigue, and in extreme cases, shock or organ damage from inadequate blood flow. Imagine standing up and suddenly blacking out because your blood pressure crashed. That's not a theoretical risk, it's a documented reality. For diabetes patients on insulin or other glucose-lowering medications, the risk is equally serious. Ashwagandha can enhance your medication's effects, potentially causing hypoglycemia, dangerously low blood sugar. Symptoms include shakiness, confusion, rapid heartbeat, sweating, and in severe cases, seizures or loss of consciousness. Hypoglycemia can be life-threatening if not immediately treated. Here's what makes this particularly insidious. These effects don't always happen immediately. You might be fine for weeks, then suddenly experience a dangerous drop because the cumulative effect finally tips the scales. If you absolutely want to try ashwagandha while on these medications, you need close medical supervision with frequent monitoring of your blood pressure or glucose levels, and very likely dosage adjustments to your medications. Your medication is keeping you alive. Don't undermine it with unmonitored supplements. 5. Surgery patients. Planning surgery in the next few weeks? Still taking ashwagandha? Then you need to stop immediately, and here's why this could literally be a matter of life and death. Ashwagandha affects your central nervous system. It has sedative and calming properties, which is partly why people take it for stress. But when you're heading into surgery where you'll receive anesthesia and other central nervous system depressants, ashwagandha can dangerously amplify these effects. Think about it this way. Anesthesia is a carefully calculated science. Your anesthesiologist determines the exact dosage needed to keep you unconscious and pain-free during surgery, but not so much that it suppresses your breathing or heart function to dangerous levels. They make these calculations based on your weight, age, health conditions, and medications you're taking. But if you're taking ashwagandha and don't tell them, or even if you do, since there's limited data on these interactions, they can't accurately predict how your body will respond. You could experience excessive sedation, prolonged unconsciousness after surgery, dangerous drops in blood pressure during the procedure, or complications with respiratory function. Medical experts recommend stopping ashwagandha at least 2 weeks before any scheduled surgery. This gives your body enough time to clear the supplement from your system and eliminates the interaction risk. Some conservative surgeons recommend stopping even earlier, up to 4 weeks beforehand. This includes minor procedures too. Even dental surgery with sedation, endoscopies, or cosmetic procedures require the same precautions. Don't assume only major surgeries count. Always provide your surgical team with a complete list of every supplement you're taking, no matter how harmless you think it is. Your surgical safety depends on your anesthesiologist knowing exactly what's in your system. 6. People with stomach ulcers or digestive issues. If you suffer from stomach ulcers, gastritis, acid reflux, or inflammatory bowel diseases like Crohn's or ulcerative colitis, ashwagandha might aggravate the very problems you're trying to manage. Here's what's happening. Ashwagandha can irritate the gastrointestinal lining in some people, particularly when taken on an empty stomach or in higher doses. The herb contains naturally occurring compounds that can increase stomach acid production and cause irritation to already inflamed tissues. For someone with an active stomach ulcer, this is particularly problematic. Ulcers are essentially open sores in your stomach or intestinal lining. Introducing an irritating substance is like rubbing salt in an open wound, literally. People with ulcers who've taken ashwagandha report increased burning sensations, sharper abdominal pain, worsening acid reflux, and in some cases, ulcer bleeding. If you have inflammatory bowel disease, the situation is even more complex. Remember, ashwagandha affects immune function, and IBD is partly an immune-mediated condition. While some limited research suggests certain compounds in ashwagandha might have anti-inflammatory properties, the immune-boosting effects could potentially trigger or worsen IBD flares in susceptible individuals. Many people also report general digestive upset from ashwagandha even without pre-existing conditions: nausea, diarrhea, stomach cramping, and vomiting. If your digestive system is already compromised, you're at even higher risk for these side effects. If you have any active digestive condition, especially ulcers, wait until you're fully healed before even considering ashwagandha. And if you have chronic digestive issues, start with the absolute lowest dose possible under medical guidance, and take it with food to minimize irritation. Your gut is your second brain. Don't compromise it with supplements your body can't tolerate. 7. Children, sedative users, and testosterone concerns. Let's cover 3 additional groups that often get overlooked in the ashwagandha conversation but face real risks. Children and teenagers. There is virtually no safety research on ashwagandha use in children. Their bodies are still developing. Their brains, hormonal systems, and organs are not miniature adult versions. They're fundamentally different. Ashwagandha affects hormone levels, including testosterone and thyroid hormones, which are critical for normal development. Giving this powerful herb to children without long-term safety data is essentially using them as experimental subjects. Unless specifically prescribed by a pediatric specialist for a particular condition, keep ashwagandha away from anyone under 18. People taking sedatives or anti-anxiety medications. If you're on benzodiazepines like Xanax or Valium, sleep medications like Ambien, or even just taking over-the-counter sleep aids regularly, combining these with ashwagandha can cause excessive drowsiness, impaired coordination, dangerous sedation, and cognitive impairment. Both the medications and ashwagandha affect your central nervous system, and together they can create additive effects your body can't handle safely. Men concerned about fertility. While ashwagandha is often marketed to men for testosterone support, some research suggests it might actually affect sperm quality and fertility in complex ways. If you're actively trying to conceive, you need to weigh potential benefits against possible impacts on reproductive health. Consult a fertility specialist before adding ashwagandha to your regimen. The common thread here? These are populations where we lack sufficient data and where the potential risks clearly outweigh any theoretical benefits. Listen, I'm not here to demonize ashwagandha. For many people, when used appropriately and safely, it can be a valuable tool for managing stress and supporting overall health. But here's what I need you to understand. Natural is not synonymous with safe for everyone. Your body is unique. Your health conditions, your medications, your life circumstances, they all matter when making decisions about supplements. The most dangerous assumption you can make is that something worked for someone else, so it must be safe for you. Knowledge is power, and now you have it. You know the warning signs. You know the risk groups. You know the questions to ask your doctor. Use this information wisely. If this video helped you dodge a potential health bullet, hit that like button and subscribe for more evidence-based health content that cuts through the marketing hype. And please, share this with your friends and family members. Someone you love might be taking ashwagandha without realizing they're in a high-risk category. Your health is your wealth. Protect it fiercely, question everything, and never stop learning.